Good afternoon, everyone. My name is Ian Culbert. I am the Executive Director of the Canadian Public Health Association, and I'm very pleased to welcome you to our inaugural webinar in our new series, A Career in Public Health. We're dedicated to starting on time, so it is 12 o'clock, and hopefully some more people will be able to join us as we get started. So thank you for joining us, and hopefully this will be an excellent opportunity for you. I want to start a bit, since I have a captive audience, I want to do a bit of a sales pitch about CPHA. So CPHA is one of the oldest non-governmental organizations, and certainly the oldest public health organization in Canada. We currently have about 1,200 members, approximately half of which are student and trainees. At our essence, we are an advocacy organization. We develop evidence-informed policy alternatives and then advocate for their adoption by different levels of government. That's what we're all about. We've recently adopted a new strategic plan, which is available on our website if you're interested in taking a look. So, since students make up such a large proportion of our members, we're very interested in making sure that the programs and services that we offer are of interest to you and are meeting your needs. And as so many of you are about to get into the workforce or are just recently into the workforce, this webinar series is really dedicated to helping you find a job, create a job, and create a long-lasting career for you in public health. We're also looking at developing new mentorship and networking opportunities for students with the broader membership. And as you all may be aware, we host a national conference every year, and there's always a very strong student contingent in that program. So the webinar series, this is the first time that CPHA has offered such a webinar series, and it's completely geared for students and early career professionals. So the sessions will take place monthly in this time slot from 12 o'clock to 1 o'clock Eastern Time. And we did some surveying before we determined that time, and it was agreed actually across the country that it was a good time for a webinar. So that's why we chose that time. We want to engage students and early career professionals on a variety of different topics, including leadership skills, which is the topic of today's webinar, and give you an idea about the range of jobs that you might be able to find in the public health field. So these webinars are free to CPHA members, but non-members can join in at a cost of $12 each. But if you note, it's much cheaper to become a member at only $88 for students than to pay $12 for each of the webinars. So I'm just planting that seed. You might want to think about that. So we will kick off our first poll of today's webinar. We'd like to get an idea of where you are connecting to the webinar from. So you'll see there's a poll on your screen. Let us know what part of the country you are participating from. And you see the results get broadcast immediately. Okay, if you want to take a second. So great. We're seeing just over half of our participants are from Ontario, about 10% from Quebec, which is great. 15%, 17.5% from Alberta. Come on, Alberta. And early risers in BC are showing up as well. So thank you all very much. That's great. We have a snapshot of where you're connecting to us from. Now, we'll actually go to our next poll, and we'd like to have a bit better idea of exactly who is participating in today's webinar. So take a look at the options on the screen before you, and hopefully one of those suits the bill. And if not, there's that other category. So let's get a snapshot of who is participating. Great, so some undergraduates, some good number of MPH students, some PhD students, so that gives us a great snapshot. Okay, thank you very much. And then our third poll for this segment of the section is we just want to get an idea whether or not participants are members of CPHA. Great. See, you've all caught on to the poll technology very, very quickly. So obviously we have a young, tech-savvy audience with us today. So great. Well, that's perfect. We'll just go back to the presentation for a second and give you an idea of some of the controls that you have available to you. So in addition to the active listening, we hope to engage you throughout the webinar. You've already seen how the polls operate, and you did that exceedingly well. You can update your status throughout the webinar using the options displayed here on the left-hand side. The first image on the left-hand side of the screen. So if I'm speaking too softly, or later Ardene is speaking too quickly, you can give some kind of indication to that. Or if you really are taken by something, you can show laughter, or if you want to agree with something, you can applause as well. So that's all welcomed. But rather than raising your hand, because we have so many participants, we're going to ask you to post any questions or comments you might have in the chat box, which you should see in the lower right-hand screen portion of your screen. So you just type in your question, and we encourage you to make your questions, comments visible to everyone, so everyone knows what's being asked, and we'll avoid some duplication that way. We will make every effort to answer your questions during the webinar, but we will keep track of all the questions and post responses shortly after the webinar has finished. We will also be sharing the presenter slides and a recording of the entire webinar to registered participants and CPHA members. And then about 3 months from now, we will also we'll be making the entire presentation available more broadly. So with housekeeping out of the way, it is my absolute pleasure to introduce today's presenter, Dr. Ardene Robinson-Vollman. Ardene is the chair of CPHA's board of directors and has been a long-time volunteer with the association. Now, her primary interests of work are in population and public health, with a focus on health promotion, planning, and evaluation. Ardene is the editor and author of several chapters in the textbook Canadian Community as Partner, Theory and Multidisciplinary Practice, 4th edition, which is just hot off the presses this past July. Ardene has more than 35 years of experience in practice, education, research, and administration in several Canadian provinces, and truly an expert in leadership in public health in Canada. So with that, I will turn it over to you, Ardene.
Thank you, Ian, and hi everyone. It's my pleasure, and it's a real privilege for me to be a part of the kickoff webinar to this series. Today, if we go to the next slide, please, Emma, I'll start by defining leadership in public health. We'll try to give some answer to the question, does leadership have a style? Then I'll talk briefly about enablers and barriers to leadership in public health practice today. I will take a few minutes to highlight the 2015 Canadian Public Health Leadership Competencies that I had the privilege of working with, and address how to enhance our personal leadership capacity. I'm going to end today with a short video and address a couple of questions before we open it up for discussion and some other questions. I hope I'm not going to be going too quickly through this, but I'm not going to spend a lot of time on any one topic. So if we go to the next slide, I'm going to read this while you read it to yourself. This is the definition of leadership from the Public Health Agency. In the field of public health, leadership relates to the ability of an individual to influence, motivate, and enable others to contribute toward the effectiveness and the success of their community and or the organization in which they work. That is leadership, involves inspiring people to craft and achieve a vision and goals. Leaders provide mentoring, coaching, and recognition. They encourage empowerment, allowing other leaders to emerge. So my question to you, let's try out this poll again. What do you think of this definition? Does it seem complete? Is something missing? So go ahead and take your vote on this. So while we're taking our vote, I just want to talk a little bit about leadership and management and come back to this. So leadership and management need to go hand in hand. They're not the same thing, but the terms are often conflated, that is, to mean the same thing. So in Alberta, for example, instead of having senior managers in Alberta Health Services, we now call them executive leaders, but they're doing exactly the same job. So in my view, leadership and management are necessarily linked, and they're definitely complementary. And any efforts that academics make to separate the two usually causes more problems than they solve. Still, a lot of ink has been spent trying to delineate those differences. But in short, to me, the manager's job is to plan, to organize, to coordinate, deal with budgets, etc. And the leader's job is to inspire and to motivate. But people are complex and they can do both. So often managers or people in senior positions are called upon to lead. And occasionally people who are really good leaders at things are moved into management positions. So there's an ongoing debate also that I'll come back to later about whether or not leadership ability is inherent, it's part of our nature, or if it can be learned. My personal belief is that leadership can be developed by education, mentorship, and with opportunity. If a person has the desire and makes the effort to become a leader, even if their organizations are not particularly supportive. Now I'd like to go back to the poll, and I see that there's some people that think something seems to be missing. Sorry, I see Jennifer, my speaker's mic is cutting in and out. Are other people having that problem as well? Emma, is my mic cutting in and out? Okay, so some people are seeing it's fine. It might be on your end. Okay, good. Thank you for the feedback. I think it might be your Wi-Fi, Jennifer. You're quite right. Okay, so many people feel that this definition is quite complete. I see that 10% seem to think that something might be missing. Can you tell me what you think might be missing? Anybody? Well, from what I've heard about this definition being used, some people think that this is a very ill-defined, has an ill-defined purpose. It talks about effectiveness, but it doesn't say effectiveness for what. Some people feel that you're not a leader all of the time, that you might be a leader in a certain area of expertise, such as maternal or child health or immunization. You might be a leader in health promotion, but in other things like in tobacco reduction or in working on health equity, you might not take a leadership role. I think it's also important to note that while leadership might be an individual skill, we're seeing more and more often that leadership is demanded of teams. And this definition of leadership really talks about it as an individual characteristic. Are there any other comments? No? Okay. Let's go on to the next slide then, talking about leadership style. Now, there has been a great deal written in the literature, and any of you who read the leadership literature will see that a lot of has been written, and academics talk a great deal about leadership styles. But in general, good leadership seems to take either one of two approaches, a democratic approach or a contingency approach. The old style coercive command and control approach hasn't proven to be particularly effective over the long term. Now, in today's literature that I had a chance to review, the public health literature finds very much that our leaders tend to use a highly relational and creative approach that we term transformational, that helps us to deal with the chaos and the complexity and the many crises that characterize the nature of public health today. So I think that if you look at the people you admire and consider to be leaders, I think you'll find one of these three approaches being in their toolbox. Next slide, please. There's also a great deal of literature about what kind of characteristics that leaders should have. And if we examine the terms that are used in the public health leadership literature, we find that the descriptors of personal qualities can be grouped according to the categories that I've listed on this slide. So these characteristics are very positive attributes that can be applied in just about any public health context. But it's interesting that we found absolutely no literature on the effectiveness of public health leadership. So we can't say with any degree of certainty that these personal qualities will in fact lead to the achievement of the mission of public health. For instance, no literature that I could find addresses how a creative and transformational leader can act with any degree of psychological or employment safety in our current health system that is very hierarchical, driven by outcomes, oriented to acute care, and is very profession-centered rather than community or population-centered. It might be a controversial statement, but I could not find anything about what makes public health leaders that have these characteristics makes them effective. So if we move to the next slide, where I talk about what enables us to become leaders. Well, we have personal as well as organizational factors that can enable our leadership and our leadership development. So a personal desire to develop leadership ability, a cause that you want to champion, along with the relationships that you build, in pursuing your interest or your cause or your passion, go a long way towards building leadership capacity. In addition, if your employer or your supervisor values leadership, supports leadership development and training, has mentors available to offer to you, and does succession planning and gives you opportunities perhaps on vacation or maternity leaves, then your efforts to develop your personal leadership capacity are likely to be supported. Also, human resource policy that fosters the ability to all of us, regardless of our professional backgrounds, to work to our full scope of practice is also very enabling of leadership. Now, if I go to the next slide and talk about barriers, there's no question that our organizations, as well as ourselves, can pose challenges to leadership development. And I must say that you'll find much more in the literature about the barriers to leadership and leadership development than about things that enable leadership. So we have human challenges. For example, in today's work context, we have many colleagues that find themselves very tired, overloaded, overwhelmed by their demands, and in danger of burning out. We have personal challenges that include our own lack of political power in our organization. We might not have mentoring. We might have huge caseloads that we have enough trouble managing without taking on additional challenges in the workshop. And in today's tight budgets, limited opportunities for continuing education, which is why I think the CPHA opportunity for webinars is a really good option for those of you who can't get out of the workplace to take courses. We can also find tension caused by competing demands of our work lives and our home lives, our position in the organizational hierarchy. If we're lower down we're on the front lines, for example, we're not in management positions, we might not feel we can have influence. There might be some lack of trust in causing tension. Decision-making and communication may not be as transparent as could be helpful to us, or, heaven forbid, that there's opposition or resistance to those of us who are trying to develop additional skills. Also, our bureaucracy, the structure of our organizations, and the culture, such as our organizational norms, the lack of common vision or communication, these things can also impose barriers. And those of you who have engaged in multiple change efforts in your organizations can see the fatigue that people experience from ongoing change and no stability within the workplace. And personnel issues, we all experience at some time staff shortages, management that isn't particularly effective, what we consider to be poor allocation of our limited resources. Maybe there's a workplace conflict or lack of lack of access to infrastructure support such as information technology, mobile technologies, etc. There's also, I think, sometimes a lack of political will, either on our own part or on the part of our colleagues or the organization to innovate, to tackle the tough issues that face public health, or an unwillingness to challenge the status quo. These things can also cause immense frustration that can place a barrier on our ability to develop leadership. And I'm sure if we opened up a poll right now, we would all add to this list of barriers, but let's move on. I'd like to ask you in a poll now about the Canadian leadership competencies for public health practice, and I'm wondering if you are familiar with these competencies or not, and how you learned about them. Did you learn about them at work or in class, or maybe through a colleague who'd seen them, or from social media? I'd like to get an indication of how you learned about them. Okay, so I see that the most of us online are either unaware or only vaguely familiar with these statements. And great, I see that over half of you have learned about it through school, and about 15% from your employers. I do know that there was a session at the CPHA Public Health 2016 conference. So we'll close this poll. I think that's very interesting, and let me move to the next slide and tell you just a little bit about these competencies. So the Public Health Agency funded the Community Health Nurses of Canada and its partners, that is the Canadian Institute for Public Health Inspectors and the Manitoba Public Health Managers Network, along with a panel that represented the 7 public health disciplines as well as key stakeholders. And they were contracted to create a set of leadership competencies that would build on the core competencies for public health, as well as the discipline-specific competencies for these 7 disciplines. Each of these earlier sets of competencies included leadership as a competency at the core level as well as in the disciplines. This leadership competency development project took place over 3 years in several phases. A scoping literature review was done. An online survey of members of the 7 public health disciplines was carried out, along with focus group webinars with leaders that had been nominated from each discipline and stakeholder. This was followed then by a Delphi process that was used to actually create the competency statements themselves. And these statements are relevant to the multiple disciplines and anyone who works in public health practice in Canada. I can speak with some ability about this because I was the academic partner contracted to do the environmental scan for this this project. Now, after the Delphi, 5 categories of competencies were developed. Transforming systems, transform the public health system and the health system to achieve the results we hope to achieve in public health, to lead ourselves, to engage others, and to develop coalitions. So there's insufficient time really to address all the competencies in this one webinar. But you can acquire the document from the Community Health Nurses of Canada from www.chnc.ca, and it's available in French and in English for $17. So if you just go on their website, you can see an example of the competencies, but the competency document is available for a small charge of $17. So today, because I can't focus on all 5, I'm going to focus on the category called Lead Self, and it has 8 competency statements that you can see on the next slide. So these are in short form. They're longer statements in the competency statement document itself. But I really want to focus on the one that I've highlighted in red, the fact about self-awareness and being reflective. So let me take you to the next slide and ask you to reflect on the question, how self-aware are you? So last year, Anthony Chan wrote in the Harvard Business Review, "You can't be a good leader without self-awareness." And then he posed 5 ways to increase self-awareness, and I found this quite good, because these are ways that I have personally used over my career in order to think about what I'm thinking about, how I am approaching my work and my own way I do things. So take moments to pause and to reflect. I ask myself, what am I trying to achieve? What's working for me and what's not? What's slowing me down? What do I need to think about changing in order to become better at what I'm trying to do, better at leading people? I'm not so good at journaling, and I know some of you who've come through various courses probably never want to journal again, but it does help to find some way at some point in time, maybe the new year, maybe in September when things seem to gear up again, to write down what your key plans and your priorities are, and then to track your progress. I keep a notebook every day of my meetings, people I've spoken to, things I need to do, my to-do lists, and about every 2 or 3 months I go back over the previous pages and I try and say, are there any patterns here that I can learn from? And I think that has helped me. Other people find it easier rather than meditating to use a journal, and they're both really good ways to track what you are thinking about and how you'd like to move forward in your own goals. It's also interesting to take various tests. I'm not talking about going on Cosmo or Canadian Living or whatever to take those tests, but tests such as the Myers-Briggs inventory and the color tests, they're good to serve as kind of data points to corroborate who you think you are, repudiate who you think they are, and if nothing else, they can lead to immense confusion that can lead you to think about things, or it can really sometimes lead to thigh-slapping laughter as you share this with yourself, your friends, and family. But they are good opportunities to probe yourself and create some awareness. If you have trusted friends, people who will be objective and who won't mind calling you out on certain things, these can be excellent sources of feedback. They can be an honest mirror to you. Don't ask your family, because they always want to support you and be nice to you. They're not always as objective as your friends might be. And then we have formal processes, such as your performance appraisals, that can offer you some constructive feedback on your strengths, your weaknesses, and maybe some of your blind spots about yourself. Every so often, consider taking part in a 360-degree performance feedback process. This can be a real learning opportunity so that you can become consistent or constant, and so that what you say, think, feel, and do all mesh so nicely together. And let me just underscore that becoming self-aware, building self-awareness, is not something you can do once and be done. It's also not something that's particularly effective if you only do it the day before your performance appraisal. It's a lifelong effort. It's something that you need to think about on an ongoing basis. Think about it when things are going well, and think about it when things are not going so well. Now, at this time, I would like to show you a short video. It's quite charming. It's a little bit funny, It's only about 2.5 minutes long, so I'll be quiet while you enjoy the video, and then we'll come back to our conversation. Wait for it. It worked yesterday, so I'm sure it's going to work today. Thank you. I hope you you found that to be as charming and as informative as I have over the years. Sometimes leadership isn't just being out in front of the crowd. Sometimes it's being a first follower or a second follower, or joining the movement as it happens and finding your place in it. And as I conclude this, I just want to underscore that leadership should be well distributed throughout the organization and the community. As I said, sometimes being a good leader means being a good follower. I encourage the young professionals that I know, and I encourage you, don't stop learning once you graduate, but take advantage of opportunities, because everyone starts somewhere and every journey begins with a first step. Don't forget to appreciate others along your journey, especially those people who have mentored you, your colleagues who have supported your efforts, and to give back when and where you can to help your colleagues develop their own leadership capacity, because as much as our own leadership development needs to be nurtured, we in turn have a responsibility to nurture others. I recall working, for example, with a community group, and we always try, as many of you have or will, to bring community members in to help to solve complex problems that we're dealing with. And in this one instance, a community member was very shy and didn't speak up very often, but brought the most wonderful baking to every meeting. So we built on her baking skills, asked her to speak up, and it really only took about 2 or 3 months, and she was a very solid contributing member to the group and became co-chair after about a year, and was very much a leader based on the support that we were able to give her, starting with her strength and what she was willing to give to the group in terms of her baking. So part of what we agreed to do with the webinar was to talk about the next slide. How good are your leadership skills? Now, there is a test you can take, but don't take it now or it'll knock you off the webinar. But this is just a cute little test to give you some idea of what you might already have as leadership skills, and what you can build on, and maybe what you might want to work on in terms of things you're not so good at. But I was asked a question earlier on the chat line: what kind of credentials do you need to be a leader? Well, I'm not sure you need any credentials. Have you been told that you have good people skills? Do you have a positive attitude about things? Are you generally a good communicator? These are pretty good attributes to have for leadership. I don't think having a degree necessarily makes you a leader. What it does is it gives you an employment opportunity where you can build and exercise leadership skills. Ask yourself, do people seem to come to you for suggestions on how to approach complex problems or things that are troubling them in their practice? They think you're a leader. So develop some confidence. If they're coming to you, you must be having some skills already. I also think that if you're curious, if you read journals, and if you stay current in your field, you can offer leadership based on evidence, which is very important in public health, not just leadership built on instinct or experience, both of which are important, but being able to back that up with evidence. People have asked, how do you develop those skills? And in the next slide, I've listed a couple of things. But basically, it boils down to this: get involved. Take a chance or two. If you fail, dust yourself off. Try again. You'll have learned something from the experience that you can tell others about that are not doing well and have had a setback. Sometimes it's quite humorous about how you've fallen flat on your face, but learn from it is the main thing. So find your passion. Try to figure out what you want to do. Find some. If you can't find your opportunities at work, find something outside of work. So I think that's all I have to say. So let's open this up then to some discussion. I see Christine has asked the question: does CPHA think that certification in health education, such as the Certified Education Specialist credential from the National Commission for Health Education, are important. Ian, are you still there? Can you answer that? I know CPHA has been engaged in a certification project. There are differing opinions on the importance of certification for public health professionals. The project is in some ways still ongoing. Ian, can you, would you like to address this question?
Professional activity in Canada, and certainly leadership would be part of that. At this point, I don't think that we're in a position to say that specific certification around leadership is required, but that could be something that evolves in the future. So it's very much an evolving area for CPHA and for public health to be taking a look at the role of professional certification and what it means. As you're aware, for doctors and nurses, dietitians, nutritionists, you will be receiving your certification in that profession. So being certified in public health is a second layer of examination that we think is important, because understanding the public health conceptual framework is really important. It's different from a clinical setting framework. So we're continuing to have conversations with the public health employers, with employees, with government to see how this is going to evolve. So I'm sorry, it's not a cut and dry answer for you, but it is certainly something that we're exploring and moving forward with.
And there's no question that if you pursue courses, other degrees, other credentials, you know, in your clinical specialty area, in management, such as you know, health administration, there's no question that those can help you move up the ladder within the context of your organization. And quite frankly, the more clout you have within the organization, the easier it is to exercise leadership, to influence, to motivate, to have a voice in the development of organizational vision and mission. So I encourage people, because going through educational courses is one way to develop the evidence base within what you're passionate about, in order to be perceived as somebody with expertise and leadership ability.
So as other people,
so Christine, if you're thinking of going for credentials, I highly support that.
Ardene, just to keep the conversation going, I'm always curious, what do you think makes some people natural leaders?
Oh, well, as I said before, Ian, I'm of the camp that says leadership can be learned. Others disagree, and they believe that leadership is something, a quality that people have, or they don't. But if you think about it and look at the leaders in our in politics, for example, some people are very charismatic, and that attracts followers. Think about the late Jack Layton, for example. He was very charismatic, and he was able to lead his party to a very successful position as opposition. Justin Trudeau is very charismatic. So people with individual people that have good people skills are considered to be leaders, as are people who are gregarious extroverts. But if these folks don't also seem authentic, if they don't engender trust in people, if they don't lack, if they lack consistency, if they're not constant in what they say and do, and they flip-flop on things, if they don't base what they're doing and saying and how they're acting on evidence, then they're not going to be good leaders over the long term. So I think some people have some natural characteristics that can be built on, but I think people who are shy, who lack confidence, who are introverts, who are thinkers before they act, they are also very good leaders too when they build their confidence. So I think
Great.
leadership skills can be built. There's no natural ability. There are some people with some natural skills. For sure.
We have a couple of minutes left before the hour is up. And Ardene, I just wanted to point out, I'm sure your examples were completely random, that you weren't suggesting in any way that there were no members of the Conservative Party of Canada who didn't have much charisma or leadership skills.
Oh no, I wouldn't say that at all. My former MP has just resigned as leader of the party and as my MP, so I try not to talk too much about the previous government. That really, in all
so one question that we
in all examples didn't seem to be a particularly charismatic
leadership is very important, especially
government.
when you're applying for a position. How can you highlight some of your leadership skills and strengths when applying for a job?
Well, I guess it takes us, for those of you who are, in school right now, I think first question to ask is, how do you develop those skills if you're not in the workplace? And I was out of the workforce for several years when I was raising my family and caring for my disabled mom. But during that time, I volunteered in my community. I taught some courses at the rec center, got involved with my son's hockey team, and those activities put me in a good place when I re-entered the workforce. Although, to be honest, they were my safety activities to get out of the house with 2 young kids and everything else going on. Nevertheless, they also offered me opportunities to show when I was applying for a job that I had been doing things outside of work and school. So, first of all, I would say when you're applying for a job, don't be shy. Call it what it is. Admit, underscore, share that you acted as a leader in volunteer positions. Tell the person who's interviewing you what you did, how you did it, and what you learned from it. Admit if you failed miserably. Be self-effacing and humorous if you can. But explain what you learned from that experience. If you are working, if you're doing things in the community or in your school or with other groups, don't wait until you need a reference to ask for it. Ask people who are telling you, gee, you're doing a good job, or that was a wonderful thing you did. Now that the event is over and we all go our own ways, ask that person for a letter. Give that person an idea of what they might say in the letter, some speaking points if you like. I've actually had students draft for me their own reference letters. Usually they're very, very humble, and I have to add to it. But think about doing those things rather than at the last minute trying to phone up somebody who might not even remember you for a reference. And I was just reading the other day about a Fortune 500 company that was hiring graduates who they were hoping to groom to be leaders in their organization. The key question they asked the people they were interviewing was, do you know anyone who is smarter than you? If the person said no, they were hired. If they said yes, the interviewer said, well, who do you consider to be smarter than yourself? And they went out and recruited that person. So don't be shy. You're the only one who knows what you did and how you did it and can explain it. Make their voices heard or speak publicly. Oh, that's an interesting question. Do you have some suggestions for everyday tips and tricks for introverts specifically to put into practice in order to make their voices heard or speak publicly as leaders? Oh, that's a good example, Cheryl. Introverts have a great deal of power. I agree that that there's some people who just keep talking and talking and talking, while the introverts sit around and mull about what they're thinking about. And for me, as a person who sometimes, who often actually chairs meetings, it's important for me to know who's around the table or who's on my team, who's the muller. And after a period of time where all the talkers have jabbered on and on, give them a chance to say what they're reflecting about. Sometimes that means when you have interrupters in the group that you have to ask the interrupters not to interrupt. But basically, I have found it helpful when I've had students who have come to me with that very question to say there are programs often through your university or through your faculty or in the community to learn how to do public speaking, learn how to formulate your thinking, and learn how to speak up. One thing I always say is write down the points you want to say before you start talking about them in case you get nervous. I have to do that too. I don't just stand up and talk. I often have to have at least a card with speaking points on it. I don't know if anybody else has any other ideas for people who are a little bit shy to speak up. Please, if you do, go ahead and put it on the chat line. Yes, Andrea. Yes, if you find it best, work in small groups instead of large ones, and work your way up to, develop the confidence in the small group, and move up to the larger. Are there any tips before attending a job fair? Oh, great question, Grace. Yes. I would say 2 tips.
That's great.
Have a one-pager resume.
Folks, we are coming up
and
to
have your 15-minute elevator speech ready, at that point.
Practiced,
but and raring to go.
As we mentioned previously, you can keep entering questions into the chat room, and we will post responses to them when we post the recording and the PowerPoint presentation and the other links that you have requested. And thanks also for the feedback that our volume setting was a bit low, so hopefully that has been improved. Thank you very much, Ardene, for participating in today's webinar. I think it was a huge success, and on behalf of everyone, give you a little round of applause, and thank you for sharing your wisdom with us today. So, quick plug, a month from now on October 6th will be the second in our series of webinars. This one is going to be focusing on Canada's public health system.
It's my pleasure. It's great to have such a wonderful audience. Thanks, everybody, for your participation.
A session that we're co-presenting with the Public Health Physicians of Canada. I just want to make people aware that we also have a volunteer opportunity available right now for students as being the student representative on the steering committee for both Public Health 2017 and Public Health 2018. It's a 2-year commitment. So we're going to post the URL where you can find more information. But just point out that the deadline is Friday, so need to get an application in fairly quickly. And the planning, the conference planning starts later this month. And just wanted to highlight some recent policy and advocacy work that the association is doing in case any of it's of interest to you in your studies or the work that you do. Back at our conference in June, CPHA released its new position statement on early childhood education and care. And earlier, or at the end of August, we submitted we made a submission to the Federal Task Force on the legalization and regulation on marijuana. So you'll get to see what a public health perspective on that issue is. And just last week, we did a major media release on the call for accelerated phase-out of coal-fired power plants. So all of information on all of those pieces of work are available on CPHA's website. So once again, thank you very much for joining us today. If you have any questions or comments, don't hesitate to contact any of the people you see listed on the slide in front of you. And I hope that we'll see you at next month's webinar.